So here we go with part 2 of EF2 utilization. If you missed the first part, make sure you go back and check that out before you go on here. We ended our last section by saying that EF2 is not just about increased production. It's about a whole lot of other things. It's about access to care. So, reduce stress within the dental office. Help make the schedule more flexible. We have heard of places that you've got that little spot each day, once or twice, where you can work in an emergency patient, but sometimes we're not able to finish a complete restoration in that emergency and put in a temp. The EF2 will help you utilize your time a little better and be able to fit in more patients in that area. Help make the schedule more flexible and it reduces workload for the DDS. The DDS doesn't have to finish every single restoration and procedure. The EF's there to take care of that. Generate additional income. If you fully utilize your EF2, you're going to make some very significant differences in production income. DDS spends more time on difficult cases and new procedures. I kind of mentioned that before, presenting new cases. Having more time to spend with the patient typically increases acceptance of complicated cases. Reduce business stress. If I'm talking to a DDS now, or whether it's a DDS, a potential EF student, or a current EF, in addition to being a dentist, the dentist also is running a small business, and there's a lot there. Not only consults with the patient, but consults with specialists, and the general operation of a business that takes place. Some of that can be reduced because you may have some extra time to take care of those procedures during your regular business hours rather than having to spend time doing that after hours or on days when you don't see patients. Patients are more likely to accept staff members that they know rather than a new associate DDS. And although I will mention there's a place for everyone, and some associates even want to have an EF2, it does give you more options there. Stay in practice longer. We've had dentists tell us that we're getting close to retirement, that they're willing to stay in practice longer, maybe cut down the number of days they're working and still see the same number of patients they could see before in more days, and stay in practice a little bit longer. And the EF2 really truly brings together the true team approach to the practice of dentistry. For the EF2, it's more self-esteem, more professionalism, and significantly more compensation. And we'll talk about compensation in a couple of minutes here as we go along. What about the schedule? Well, the schedule, I can't tell you how to schedule in your office because every office is very different. And dentists have a production personality, and you know not to give them a screaming 3-year-old in the afternoon because that's when they get tired or whatever. But I can give you some food for thought on things to think about because it does require a little bit different way to rethink how we schedule our patients if we're going to be using more rooms and more things happening, that the dentist participates in a small little piece of what the EF is doing and then fully does other procedures. So here we have a sort of more stereotypical situation. EF2 moves back and forth following the dentist, and then the dentist also has a DA or RDA assisting them on other procedures. So here in this case, we have an EF2 so at the same time, so let's say this is 8 o'clock in the morning, we have an EF2 in room 2 doing a full seat and adjustment on a crown and a seat and bond. And while the DDS is doing a crown prep and following through with that entire crown prep and finishing the procedure. The dentist is now done with that, and the dentist is over here cutting a prep because the EF2 now has come into this room and is assisting them with that preparation. And then the EF2 finishes these restorations while the dentist goes in the next room and cuts a crown prep. So on and so forth. Pretty straightforward here. The next possibility is that you have the EF column with procedures that the EF2 can do independently of the dentist. So like sealants, indirect restorations, cementing, bonding, adjusting crown and bridge. patient assessment, anything that they can do on their own that the dentist doesn't have to initially participate in. And then they're pre-scheduled to go in when they're done with those procedures at various places and finish whatever the dentist is doing. So we have a crown seat, and then when they're done with the crown seat, they would move in and complete the anterior restorations that the doctor has done. So they got kind of a mix. You've got their own room, but they can move out of that room into other areas. So that gives them their own column and their own place. The other place is for the EF2 to have their own room in all the procedures. So their patients that they're seeing, like the hygienist is seeing the dentist patients, but basically it's their patients that they're seeing in their column. So essentially, as a hygiene room there, you could have an EF2 room, and then you put patients in there with all the procedures that an EF can do independently and with the dentist, and then you simply build into the dentist's schedule an extra 15 or 20 minutes to pop in to those various places when they're needed to get the preparation and or check the procedures that are being done. For me, if I was running an office, this would be probably the easiest thing for me to do. And I know that for a lot of EFs, it's easier because they can look at their schedule, know exactly what's happening. They're staying in their room. They've got their room set up how they want it, just like your hygienists like to have their room set up like they do. So for me, that would work probably the best in the situation how I'd want to run an office, but there are so many other ways to look at this. Another option, EF2 moves between two dentists. I know that I have a lot of EF2s out there that are working in primary care and public health clinics and that have to do this a lot. And so some of them are formally put into certain places, but a lot of times they're just bouncing back and forth as needed. It would drive me completely nuts, but apparently it is what works best when you have extremely high volumes of patients in primary care clinics that you need to see. So let's look at another choice here, and this is a DDS, actually moves between two EFs. I have a couple of offices in the Central Valley and the Bay Area where there are a couple of dentists, and they each dentist, by the way, can supervise up to 3 EFs, and they move back and forth between the EFs, supervising them, and basically the doctors are doing consults and cutting preps and doing hygiene checks and then participating in part of the operation of their business all day long and doing the few things that EF cannot participate in. Maybe they're doing a really heavy long case on a full mouth reconstruction or something, but the EF is busy finishing all the procedures. So that's another way to look at doing this.